Good morning, and welcome to our first edition of What's My Plan? So the goal of us at Assisting Hands is to provide not only great care to our families, but also valuable and useful information to help people make the right decisions as they move down the path of caring for their loved ones. So today, we're really fortunate because our first topic is going to be advanced care planning. And so we have Jane Markley, who's going to speak to us. She's a nurse. She's an expert in advanced care planning, and she spends her day advising families about how they can plan for the future, have the difficult conversations, and are ready so that when something happens, no one's scrambling. There's a plan, and people aren't racing around trying to get something done. So without further ado, I'd like to introduce Jane Markley and ask you, tell me, what is advanced care planning?
It's an opportunity for you to communicate to others what's important to you, what matters most to you. It includes everything from I want a feeding tube or I don't want a feeding tube, but it also includes simple things like if I'm tucked in at night in my hospital bed, do I like my feet inside the covers or outside the covers? For some people, that's a really big thing. And if you can't communicate that to people, there's no way that they will know what's important to you. So it's a full plethora of activities, most important of which is identifying someone who can speak for you when you are in the ER and can't speak for yourself, or when you are in a doctor's office or whatever and cannot express your wishes. It's important to have them written down, and it's important to have a healthcare agent who knows what you want and can speak for you.
So let me ask you the question, because I see this all the time, so we do home care. So we're going into people's homes at a time of crisis, or we're talking to families, and the usual thing is, I don't want to have this conversation. My kids don't want to hear about what's going to happen when I'm sick, or they'll know what I want. So how do you even have that opening bridge to get the conversation started? And who does it? Is it the senior, or is it the kids? What are your best ideas on how to get this awkward conversation started?
You're right, it can be a very awkward conversation. In some families, this isn't awkward. Believe it or not, they've grown up with, usually multi-generational families are the ones for whom it's not uncomfortable because they've talked about things that might happen and they've lost parents or grandparents or uncles or whatever from different circumstances. Those people have a much better time and an easier time at going. But many of us in America have never talked about it. And it can be started by anyone in the family. And it doesn't have to be, what do you want to do when you're on your deathbed? I mean, gosh, that's definitely not the way to start the conversation. You start the conversation by saying, what matters most to you? Using an example of someone who has recently been in the hospital or recently died, gee, how could we have done that better for Uncle Fred? Should we have done something different? Is a good way to start, because it doesn't start with talking about you, it talks about Uncle Fred. And that gives people a chance to kind of explain what's important to them and what matters most. I had one friend who does the work that I do, and she had a client that basically told her, there's 3 things I want. I'm going to surgery and I have no idea whether I'm coming out as I went in or in another situation. But he said, there are 3 things that are important with me. I don't care whether I'm in a wheelchair or in a bed. I want to be able to talk intelligently and pleasantly with my grandchildren. I want to be able to articulate with them and be able to keep a relationship going. He says, I want to be able to watch my football team on Sunday afternoon, and I want to be able to eat my ice cream. And those were the 3 important things to that man. That sounds silly in some respects, but it tells you a great deal about that man and what it is that makes his life pleasurable. And those are the kinds of conversations that you can use as a starting point to have the discussion. Another thing to do is utilize the tools that are out there in the community for you. Things like 5 Wishes, the Maryland or your state's tool for completing an advanced directive, and the Conversation Project. I can't recommend them enough. They have lots of helpful questions that you can ask your family and ways of starting that conversation that may be even more useful than just what I've talked about today.
Would you be able to, either send out an email later with a link to the conversation starter? Because we'll get to the documents and sort of the planning next, but I really want to focus in on how do you start this conversation? Because I see so many times right now we're caring for 2 families where we have a 90 or an 89-year-old parent who is now taking care of their 60-year-old child with disabilities.
Absolutely.
And, one of them, I asked her, what was your plan? And she said, Steve, it's going to sound embarrassing, but I thought I would live forever. That was my plan. I didn't think I'd have to worry about this.
Mm-hmm.
And she's now realizing that wasn't really a likelihood that she was going to live forever. Although she might, she's 90, she's in great health. But it just never occurred to her. And she didn't want to face the difficult situation where she was going to have to ask her other children to be the ones to step up and make sure their brother or their sibling was well taken care of. So again, are there some warning signs that if we're friends or family members that would give us a sign, hey, somebody needs to have this conversation, or to encourage people to start thinking about planning?
Good questions. Everybody needs a plan. And that's the thing. You shouldn't wait until there's a crisis or till you're old or sick or all those types of things. I work with 18, 19, and 20-year-olds who definitely need to have a plan because they're graduating from high school, they're either going off to college or they're going out into the workforce. Most of them, except in Corona times, will be probably going off on their own, and they'll be separated from their family in some way, shape, or form. What happens when their friend takes them out on a fast drive and they end up into a tree and you end up in the emergency room? Do you have any idea what that young adult would want or what that young adult is expecting in terms of their life? Those kinds of questions are important that family members know. The other thing that's critical for that age group is they no longer are dependents, and therefore their health records are closed to their parents. Their parents may not even get a phone call if they end up in the emergency room unless they have an advanced directive that directs the hospital to contact whoever the healthcare agent is. Having that is a great relief for everyone. I mean, even the kids say, well, my mom and dad will just come and take care of things. Well, number one, they probably can't take care of things, but they probably won't even know. So having an advanced directive should start early, and then it changes over time. Not that your basic beliefs and values change, but what kind of health care you desire may change depending on what kind of medical issues you have, what kind of work-life balance you have, depending on who you grow into as you age.
So, okay, so let's say, I've drank the Kool-Aid, I recognize I need to get a plan. What are the documents I need, and who has those documents? Who helps me put them together? Is that something you do? Do I have to see a lawyer and spend a lot of money? Are they online? How do I go? What's the next step? I'm in. I want to go sign up some docs.
Okay, you want to put together your advanced directive. First, you need to start the conversation with your family. And using the documents that are out there is a very good way to start. You can go to a lawyer. That's certainly an option. You can come to me, and I can help you through the process. Or you can do it on your own. And the only thing I will say with that is you can do it on your own if you will do it. So many people say, oh, I'll just do it on my own, because there's lots of documents out there. There's lots of forms and tools and helps on the internet. And what I will do for you, Steve, is I will send you, if I haven't already, I may have already sent you the one-page references page that you can send out to everybody. And that lists some of these
Great.
resources that I'm talking to. Those references will help move the process along. But what I find is, in fact, I had one client who came to me last year, and she said, you know, you talked to me 4 years ago because I went to this course and you told me all about this. You gave me some documents, and they said they've been sitting on my desk for 4 years. And every time I get down to them, I go, I'm not ready to talk about that. And they go to the bottom of the pile. And she said, I've finally decided I need to take it off the bottom of the pile. I just had a friend who had a horrible accident and was in the hospital, and things didn't go well because we didn't know what she wanted. And I want to make sure people know what I want. So she came and worked with me, and it's the reluctance to move forward that causes a lot of our incompletion of advanced directives. Obviously, if you're going to pay a lawyer and you're going to go into their office, they're going to get it done. I give a caveat on that. Some lawyers do a superb job, especially the elder lawyers, elder care lawyers. They do a great job, but some lawyers don't, because there are specific things that are important to be included in an advanced directive, and sometimes they fail to cover that. So pick your elder lawyer carefully, or your lawyer carefully, is what I would say to that. I do a lot of work with individuals who know they need this, and it's been sitting like that lady on the back burner for some time. And all I do with them is give them the process, get them moving forward, and then be kind of their accountability partner. You know, a month's gone by. Hey, have you had a chance to talk to your daughter about this? Well, oh no, we put it off. I said, well, now's the time to do it. And we keep badgering them until, just to make sure everybody gets through this, because it is an uncomfortable process, and depending on your family.
All right. So what's the difference? So advanced directive, from what I'm understanding, is that's the document that goes through and explains how you want to be treated when you can't advocate for yourself. Mm-hmm. How does that differ from the MOLST form, the Maryland form?
The duty question. Both? The duty question. Everyone needs an advanced directive. Anyone 18 years of age or older. The MOLST is not an advanced directive. Okay. It is a physician's order, and should be based off the advanced directive. It is an order that's written by a physician or a nurse practitioner or a PA based on their conversation with you about the kind of care you would want in a crisis, and primarily focuses on CPR for most people, because that's the big crisis that most people will face. And it is required in Maryland for anyone who is in a nursing home, an assisted living center, a rehab center, transfusion center, anywhere where care is being rendered, where something might go afoul and quickly, and they need to know what to do if someone were no longer able to, or no longer breathing, or didn't have a pulse. So those are institutions where it is mandated in Maryland. It's also mandated in the hospitals in Maryland for certain populations, mostly the populations whereby they might be going to one of those facilities after their hospitalization, because this gives the EMTs, the people who are doing the transport, written guidance from a physician as to what they should do if something untoward occurs.
Gotcha. Okay. So now let's say you're doing it all. You're in your 80s and you've got some health problems. So you have been in and out of hospitals. So you have your advanced directive. You have your MOLS form, which is based upon the advanced directive.
Mm-hmm.
What other documents do you need? Like, do you need powers of attorney, and are there different ones for finance versus medical decisions, and you need those also? Is that part of the advanced planning?
That is part of advanced planning, yes. Advanced care planning is basically the advanced directives and the MOLST. But an advanced directive is made up of two things: your living will, those things you would like or not like in terms of healthcare treatments, and the delineation of your healthcare agent, the person who will speak for you if you can no longer speak for yourself. That is a durable power of attorney for health care.
Okay.
Okay, so that's the healthcare piece of it. There is also a durable power of attorney that is done usually in a law office along with your will and estate plans or whatever you might be doing with a lawyer. That is specifically for the financial aspects. The two are different. One is strictly for healthcare, one is strictly for personal property and finance. The same person can hold both roles or not. You know, if you've got a bunch of kids and you want to give them all something to do, you give one and one the other. I mean, there's a lot of different strategies on how to make your children feel like they're participating in your care as you move forward. The one thing you can't have is a joint decision-making group. In other words, you can't make your children your healthcare agent. It's one person. You can make all three children say your healthcare agents, but there always will be in a precedence order. And that bothers some people, but it is probably for your best interest, and certainly the best interest of people making decisions, that you have one person who makes those decisions for you, much like you do with a durable power of attorney for the financial side of it.
Well, and that's a great thing to point out, because we've seen situations where both kids have a joint decision-making process for healthcare, and they have different views, where someone is very sick and one is of the view, we need to move to hospice, and the other one's view is, no, we need to do everything humanly possible to save mom or dad. And then they get paralyzed because they can't make a decision. And then
that's where it's extremely important that you know what mom or dad would have wanted, because that's the driver. If mom and dad have said, you know, don't let me linger, I've had a good life, let me go, then the person who is doing the full court press is not following their loved one's wishes, and therefore they're negated in the decision-making process.
Right. Okay.
So interrupt for just a second and tell you that you got about 8 minutes left, and there may be some questions from viewers. Viewers, if you have a question and you'd like to ask our expert or Steve, feel free to unmute yourself, and we'll just go in whatever random order you select.
All right. So I've got one more for you. So you've had the conversation, you've got all the documents, and where do you put them?
Yeah.
Because I'm in people's houses all the time, and I'll say, do you have advanced directives? Yes. Where are they? They're in our lawyer's office, and we have a copy in our safe deposit box. So what do you say to that?
You say, remove them from the safe deposit box. If you are insistent that they go in a box, they should go in your glove box. And that would be a copy. And a copy of the document is as good as the original document. So copies are fine. Whenever you do an advanced directive, a copy should be given to everyone you have spoken to about what you want, which should include anyone who might get that middle of the night phone call from the emergency room, whether that's your next door neighbor or your daughter or your mother or your sister or whomever. You want to make sure that you have the conversation with all those appropriate people and make sure they have a copy. You also ought to make sure that your physician or your healthcare system has a copy. If you're involved with a faith-based group, they should have a copy. But in Maryland, we have a really, really neat opportunity, and that is the opportunity to upload our advanced directive, no matter what kind you've done, whether you've done a 5 wishes document or a state document or any other document. You can get it uploaded through my directives, through Voice Your Choices, and that should be www.voiceyourchoices.com. In there, it will ask you if you want to do an advanced directive, and what you do is you click on the green button on the top right, and it takes you to my directives. I recommend you do it through Voice Your Choices in order to get it documented so we can keep track of it. That system, you may use my directives as your tool to make your advanced directive. It's not required, however. For example, I used 5 wishes for my updated document, and I went in through Voice Your Choices to my directives and uploaded my document into the system. That allows any hospital in Maryland to be able to access my advanced directive at any time.
Wow, that's a great tip. I didn't even know that. So that's fabulous. So if you're going to have a copy in the home, so where do you put it so that when EMS comes, they know?
Yeah. The routine and the standard for that is you always should have it on the refrigerator and available. A plastic covered list, we talk about being prepared for a crisis. Everybody ought to have on their refrigerator the information that you would want to take or someone would want to have when you show up in the ER. What medications are you on? What diagnoses do you have? And if you have an advanced directive, that should go in there, and definitely the MOLST should go in there and be available. I had a client a few years ago. We'd been working with she and her husband, and her husband had an event and they needed to call 911, and the EMTs came rushing in, and as always, 2 of them come in at the same time. One went to her husband and the other one went to the refrigerator, and she called me and she said, I didn't understand. Do you think he was hungry? And I said, no. If you remember when we talked, I said, that's where you should have your documents. Were they there? And she said, yeah, they were there, and he picked them up. But I forgot about the fact that that was why they were there. So yeah, gotcha. They know where to go for it. So
if people want to work with you or to learn more from you, how do they reach you? How do they get in touch with you? It's really easy. My email address is jane@mjmarkley.com. You can always look the MJ Markley up on Google and find my website. You can learn more there. I do a lot of educational programs in the community and with hospitals and healthcare systems to help them understand all of this. It is a moving target in some respects because the MOLST is relatively new and still becoming much more familiarized with people. And I'm more than happy to work with individuals or groups to educate and to facilitate the one-on-one work. Okay. So Patricia, do we have any questions? Because if not, I have one more for Jane.
I'm just letting folks ask. There's nothing in the chat.
Oh, okay.
Well,
So
I think someone did
I
bring
have
up.
a question.
Here we go.
Someone-
Yep.
Can you say who you are when you ask the question?
Yes, this is Mado from Joint Hands Assisted Living.
Great to have you on board, Mado.
Yeah, my question is about voice your choices.
Yes.
Can we upload the will from that website too?
You mean your living will? or-
Yes.
Yes. Your advanced directive is what you upload, and that includes your living will and your durable power of attorney for healthcare. Yes.
And
So
that
you-
is for free, and I can just fill it out and bring it to to the bank or wherever to notarize and keep it in my files.
An advanced directive does not need to be notarized.
But the will does, right?
A living will does not.
Okay.
Okay.
So an estate planning will, so a will about who gets your assets, that can't be uploaded to your choice. That's a personal private document that you wouldn't want uploaded. And that does require in Maryland, a notary and witnesses, but that's a very separate document that deals with who gets your assets after you've passed away. Different
Okay,
than
thank
what
you
we're talking
for
about
that
here.
specification.
Yeah.
Sure.
Someone brought up the file for life, and that's what that's the term that's used in Maryland for that document that's on your refrigerator. And any fire station can give you the file for life paperwork that you can have on your refrigerator. I have it on mine downstairs. It's just available for the fire department when they come in, and it too is on the refrigerator and available.
So when we do assessments with clients, when we start care with people, we give people that need them a copy of the 5 wishes, which is a document that is very simple, easy to use, takes you through all the questions that Jane's been talking about today. And we also give them a file for life to put on the refrigerator.
Good.
So, both these things are really important. I say that as a person who, of course, has none of that in my own home. And my advanced directive is sitting in a file in my basement, which I'm sure no one will ever find, not even my wife, because she will be in crisis mode when it happens.
So you have work ahead of you, Steve, don't you?
I do. Thank you for reminding me of all of this.
Yeah. Yeah, it's easy to put it off because we never think that we're going to have a crisis like that. We never, even though we're whizzing by people on the Beltway every day, we don't think that we're at risk, and we all are at risk. And it's extremely important to get it out of your file cabinet. Good Lord, don't ever put it in your lockbox. That's only opened after you died, which is not going to do a whole lot of good for you in the living sense. And it just get off your duff and keep moving. All
right. Well, thank you for joining us today. This has been hugely helpful. I know even though I've been doing this for years, I picked up several. We've got somebody that's got a question. So go ahead, Alice.
Alice?
Hi. Thank you for a great topic, but it's something that we doesn't really like talking about. But I wanted to find out with this advanced directive, let's say, you prepare your advanced directive, you put it in the places where it ought to be if an emergency occurs, and it's other people have copies of it. But let's say an incident happened and you want to change it on the last minute. You call for 911 and you want to change it. Your changing is DNR, and you want to take off that DNR to be, they try everything to keep you alive.
Mm-hmm.
How do you go about that?
Well, to begin with, if we're talking about me and I have the advanced directive and I am alert and awake and calling 911,
mm-hmm.
I can do anything I want with myself while I'm still cogent. The advanced directive only goes into effect when you can no longer speak for yourself.
Okay.
So, and you can always change your advanced directive
Okay.
by doing a new document and having it witnessed.
Okay.
But if, for example, I were to have an event and I had a DNR
Mhm.
written in a most and had that on the refrigerator, and I had an event and I said, well, gee, I had a DNR, but I wasn't expecting my to feel this way. I really do want to be cared for. Then that takes precedent over any paperwork. The problem is most of the time these people are no longer cogent, and then that's why they've put together a plan. And so the plan needs to be updated periodically, certainly if your mind changes.
Okay. Makes sense.
Does that help?
Yes, yes, indeed. Thank you.
You're welcome.
So I also want to mention that our next event with Steve on What's Your Plan will be September 11th at 9:30, and we're going to have Susie Murphy, and she's the Director of Care Managers at Deborah Levy Elder Care Associates. So please look at our website. We have lots of other events every month, and they're educational and fun and informative. And I hope this gave you some insight. I know I learned a lot. Thank you so much, Jane. Thank you, Steve.
Not a problem. Everybody should listen to Susan Murphy. She's wonderful. So
Yes.
point to see her. And if I can help anybody, or you have any questions that I didn't answer and you were timid about asking or think of after the session is over, feel free to email me and let me hear from you.
All right. Well, thanks again. And thanks to everybody for joining us today on our first of many What's Your Plan?